Some people pass, they can listen and hear the different footsteps. Or everybody walk different.
Okay.
So you can listen. Some people walk and draw, some people walk with and slower. Yeah. So you can know the difference. Some call name, sometimes I'm right, sometimes I'm wrong, but 90% of the time I'm right.
Okay.
I have a thing named Alexa.
Yes.
Very boy, I'm tell you one of the best technology that ever come around. Alexa, turn on the light, turn on TV, Alexa, turn on this, turn off that. And it's good to me. My sister said, send me Alexa, man, I tell you.
Yeah, do a lot for you.
Lot. I change rapidly. Rapidly, every way.
Can you give us some example?
Mental, emotional, physical, every way. Some of your friends, all the friends them doing them. I tell you, when I get sick, everybody now who close to you, them gone. Take care of your health. That's the main thing, you know. Visit the doctor regularly, don't matter. We as man, we're afraid of the doctor. But advice you stop and just push your ego to the side and just visit the doctor and pay the doctor a visit. It don't matter how often, but you pay the doctor a visit. That's the main thing I leave you with viewers.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which will talk about life, sickness and death, and today's topic will be discussing glaucoma. And in office with me today once more is Mr. Everton Hibbert. Welcome to the show, Mr. Hibbert.
Yeah, welcome.
Good. Alright, so before we get into the discussion, please remember to share, like, subscribe and leave a comment on this video, and stay tuned for more informative medical content. Now, glaucoma is a condition in which the optic nerve is damaged, right? So the optic nerve is the nerve that transmits visual information from the eye to the brain, which enables us to see, right? Now, the damage to the optic nerve is normally as a result of the pressure in the eye becomes elevated, right? So like too high pressure in the eye. However, in some cases you can also have glaucoma in which the eye pressure is normal and will still result in glaucoma. Now, glaucoma is the leading cause of blindness in persons over 60 years old. So it is a very common condition in which everyone should be familiar with, right? And get your eye tested. Now, there are two major types of glaucoma. We have open angle glaucoma, and this is the most common type, and it normally is a slow onset of blindness. So initially you may have no symptoms, however you have gradual loss of the peripheral vision, and then which gradually in later stages lead to the loss of the central vision as well. The second major type of glaucoma is the acute angle closure glaucoma, which is normally a rapid onset glaucoma in which we have blurred vision associated with severe eye pain, severe headache. Some persons may have nausea and vomiting, and also like halos around light. Now we have other types of glaucoma, like normal tension glaucoma, or you have like congenital glaucoma, which we're not going to really discuss much today. Now, for the diagnosis of glaucoma, normally this is done by ophthalmologist, so it's an eye specialist, in which a comprehensive eye examination is done. So normally, definitely, they would need to test the pressure in the eye, which we normally call it intraocular pressure. They also look at the optic nerve, and sometimes some persons may measure the thickness of the cornea, as well as to test the peripheral eye vision, right? And also they can do additional tests as well, comprehensive, which is normally done by the ophthalmologist. Now, you may wonder what are the risk factors of glaucoma. Well, the risk factors of glaucoma include like family history of glaucoma, patients that are 60 years and older, and also persons from African descent. Also have persons which have eye trauma in the past. Also have persons with chronic illness such as diabetes, some persons that have hypertension or chronic migraine are also at an increased risk of getting glaucoma. Now, in terms of the treatment, normally glaucoma is managed by the ophthalmologist specialist, but normally the treatment tend to be one of three options depending on the severity. And we normally start with medication, which are medication in eye drops, and normally these medication work, eye drops work in one of two ways, either to decrease the fluid production in the eye so that the pressure can be reduced, or some of these eye drops may increase the outflow of the fluid that is produced in the eye. So both these mechanisms, we normally give a combination of these eye drops in order to get a better reduction in the pressure in the eye. Now, if the medication fails, some persons may require surgery, and in modern time they have laser surgery, and they also have open surgery which they can do in the operating theater at the hospital, which is done by ophthalmologists, right? So this would basically give a summary of glaucoma, and now we're going to get into the discussion, because my guest here, which is a regular guest on this program, is Mr. Hibbert. He has multiple chronic illnesses, and glaucoma is one such of his medical illness, and he's a patient that normally will take the time to share his illness with the world, so we are always fortunate and happy to have him in office with us. So with no further ado, Mr. Hibbert, welcome back to In Office once more.
Yes, thanks for having me.
Alright, now so you heard the discussion, that the introduction that I just gave about glaucoma.
Yeah.
What are some of the initial symptoms that you were having with glaucoma in terms of the vision? How rapid did you lose vision? Like, was it?
I lose the left one first. It was just blurry, and I hardly can see the blurry the writing. I can hardly read. I couldn't put on a phone card, and I go to the doctor and test it, and till not even 2 weeks after I lose, to get some pain in one of the eye, in the left eye.
Yes.
Very severe pain, and it's red. And we lose that one, treating it. So till the right one just gradually treating it, laser never help, because it do reach to an extent that it cannot help. And we treating it till it just gradually fade. So we have to, what the left one forgot first,
yes.
The right one now, same thing with the right one. So we get two different eye drops now. So I get one for the left and one for the right. There are times if I miss the eye drops, at night I'm supposed to use the eye drops.
Yes.
There are times if I miss the eye drops, it pains me, sometimes the pressure in the eye, and it pains me, and this water does run like a river.
Okay.
Right through the night sometimes.
Alright, but before it leads to blindness, I just wanted to have an idea if you're having how long you were having this blurred vision for that I spoke about?
A couple months.
Couple months.
Yes, I'm treating it until it does eventually go.
Okay, so how soon after the onset of the blurred vision did you seek medical attention with the ophthalmologist?
Honestly, about a month after now.
So you're having the blurred vision for 1 month before you seek medical attention.
Yeah.
And then after you got medical attention, you were given eye drops.
Yes.
And how long after starting the eye drops did the vision end up go in the left eye? So the left eye was
go first.
First. How long the initial onset of the treatment did the left eye go blind?
It take a while now, about a couple months take a while. But it pain me now and again, and I still treating and different medication, but it never helped.
Okay, and in terms of how the pattern of the vision, because notice I said that most persons that have open angle glaucoma, they normally tend to lose the peripheral vision first. Did you have any losing like the side visions first, or you just end up
losing? I lose it first, because what the doctor said, it was bleeding behind. Excess.
Okay.
So I must try to stop in the bleeding behind.
Okay.
Because diabetes make it bleed himself.
Okay. Alright. And In terms of the risk factors that they have, I discussed certain risk factors like the age and you have a family member that had glaucoma.
Yes, my mother, my auntie, them have uncle too.
Okay, so you have family
history,
of glaucoma. Plus you have diabetes as well.
You're right, so the diabetes.
Alright.
Diabetes is a man who get everything, you know.
Okay. Alright. You can tell from experience, Mr. Hibbert, so that you have other issues from the blindness. What are some of the other issues that diabetes are causing in your life?
Yeah, kidney failure
Yes.
and high blood pressure.
Yes.
Yeah, so that's very dangerous for me.
Alright.
Costly.
Alright. And in terms of the treatment that you're getting now, apart from the medication, you said that they did laser treatment as well?
Yeah, the laser the eye.
Okay.
Yeah, that laser the left one.
Yes.
And never laser the right one.
Okay, all right. And so in terms of the right eye now, how long after losing the vision in the left eye, the right one?
About 6 months after.
6 months after?
Yeah.
All right. So it's a very similar presentation for the right eye in terms of you're not seeing well in the peripheral vision. And
Yes.
Okay, all right.
But I have two different medications for it, one for the left and one for the right.
Okay. So what you have any? I can just share with yours where you have different medication for both.
Well, the left one pain me more, and the left one alone mostly the fluid come out of the left one more.
Okay.
I don't know why, but the left one pain me more. Doctor know what I'm saying, you know?
Yes.
So he give me a different medication for the left and different for the right. But the left one sometimes it alone pain me. It alone the fluid run out. Just sometimes come like a river when the pressure high at night.
Okay. Alright, so how often do you visit the ophthalmologist?
Every 6 months, sometime one, or sometime twice a year, 3 times a year, sometime.
And
Depends.
okay. And initially, when you were diagnosed how often were you visiting the ophthalmologist?
Like every 3 months.
For 3 months.
Yeah.
Alright. And I know that to lose vision is probably one of the hardest things that could happen to someone in their life. So in terms of some of the social issues that you have now in terms of your loss of vision, how was life before and after losing sight?
But it changed rapidly. Rapidly, everywhere.
Can you give us some example?
Mental, emotional, physical, everywhere. Some of your friends, all the friends them doing them, I tell you, when I get sick, everybody now who close to you, them gone.
Okay, so how does it affect, like, you know, that you operate a bar, how does it, the loss of vision affect your business?
Affect it badly, but you have to use your knowledge and monitor things. Because, for instance, somebody give me $20,000 and tell me says $20,000. When I feel it, luckily,
yes.
I can feel the money. When I feel it, it's 16,000.
Okay.
5,000 and 1,000.
Yeah.
And the street says 20,000 again. I said, no, it's not 20,000. So, yeah, whole heap of challenges from all angles, seriously.
Alright. So it's normally sometimes when a person loses one of the senses, like your sense of smell or sense of touch normally
You gain more.
More. So have you gained like increased abilities in any one of the other senses?
Yes, man. My ears and smell, man. I tell you. As sometimes some people pass, they can listen and hear the different footsteps. Or everybody walk different.
Okay.
So you can know, some people walk and draw, some people walk with and slower. Yeah. So you can know the difference. Some call names, sometimes right, sometimes wrong, but 90% at the time right.
So you can tell who is coming based on
Yes.
how the footstep as well as
Yes, I know the person that uses the cologne there, so we can notice that cologne that person have on.
Okay.
So you can smell before you even reach me.
Alright. So that's a good strategy that they developed.
Yeah, man.
Alright.
So sometimes the one that you can see, man. So them say no, man, you can't see. Sometimes we even tell them, some of them tell them secret.
Okay. But they're gonna hear it now, we say.
Yes.
Unfortunately, alright. So those are some good tips. So in terms of like, I know that sometimes younger persons would do like braille in school. Yeah, been taught to do
No.
that stuff. Alright.
Just the money, if new money them, have
Yeah.
braille on it, so I feel them.
Okay, alright. Now, so in terms of like social life now, in terms of how family and friends treat you, as you were saying, since before and after you lose sight.
Family,
Yeah.
but I say I have 80% family around me,
Okay.
for sure. Friends, 50%.
Okay.
When you lose, we can tell the man. Some of them, you will say, call such and such to me. Remember, you know? We call Dr. Summers about someone says, Mr. Hibbert, I call him don't answer. You can return what they call. You don't give back a call. So I'm just going to say, I just remember I call you back again.
Alright, another thing I want to discuss that I know that sometimes they have this new technology which you can just tell the light to turn on or tell the phone to call somebody. You use up those technology?
Yes. Luckily, I have a thing named Alexa.
Yes.
Very boy, I'm going to tell you one of the best technology I've ever come around. Alexa, turn on the light, turn on the TV. Alexa, turn on this, turn off that. And it's good to me. My sister said, send me Alexa, man, I tell you.
Yeah, do a lot for you.
Lot. And at the boring stage, you just say, Alexa, Google this something. And I have a special spot to feel it, and just touch the screen, and it just start to play. I just tell it to play. Sometimes we tell it to play from Amazon, it just plays straight.
Alright, next thing to say is that humans are visual beings, so most of our entertainment tend to come by either watching stuff on the internet in modern times or going out and seeing others in action. But what are some of the new means that they use for entertaining yourself since you've been blind?
It's see Alexa there. Just tell it to play anything from him and just press it. Or tell someone to just find this on Alexa and I listen it. If I stage show or movie, I'm just listening straight and just relax myself.
Okay.
That helped me a lot to relax. Sometimes I'm finished, and then now we have a thing that the pressure machine,
Yes.
they want to talk to you.
Okay.
And we just test the pressure, I'm say yes, some pressure, alright. I have it up, we just take 2 pills and go like that.
Alright. So in terms of like the eye drops that you use, how do you know which one to drop in which eye? Or you get somebody to do it for you?
No, you know. Alright, the left box, we tear the left box, the lid off the left box,
Okay.
we tear it, and make the right one stay. So I know when I feel it, I feel this is the left box, this is the right. As we get it, we tear it. As we go to the doctor office and say this is for the left, this is for the right. People always ask me, but you have to use your common sense, you know.
Okay.
I'm just tear the lid off of it, and I know say this is the left, this is the right.
Alright. And in terms of, I know that you have several chronic illnesses, because you're on dialysis, you have to interact with healthcare professional on a weekly basis.
Yes.
It's not daily sometimes. How do you find that they treat you when you're unable to see?
Yes, some of them very nice, honestly, some of them very nice. But you know, you have some bad apple have worse. Some of the places, you find some bad apple, or somebody have a bad day.
Yes.
So then some of them are going to treat you so much, but we get good treatment.
Alright. So since you have been blind, have you ever been like robbed like people steal things because you're unable to see?
Yeah, man.
You want to share an example?
Yeah.
Of stuff that they lose since you're not able to see?
Money. One time I remember I gave a taxi man $4,000 for $2,500. One time just losing vision,
Yes.
never feel the money so good. And I'm saying, no, I'm alone, I give the money, I give the money to.
Okay.
And take it. Take the $4,000. Yeah, people take on shoes, them and something there.
Okay.
Take what you lose, man. What you
Because they're unable to see.
Yeah.
Alright.
Right now, I'm not run the bar again because they broke the bar much time. As a blind man, them system not working. And then take what they broke the bar so we can't run the bar again. We can't do no business. I just good friend and family now help me out now.
Okay. So you're unable to even sustain a business now because of theft.
Yeah.
Which is unfortunate because they're unable to see.
Unfortunately, you see, yeah.
I guess it's just a part of the whole world that we live in.
Me I tell you.
Alright. And so in terms of the loss of vision, is there all the other chronic illnesses that you have? The loss of vision is the worst out of all our...
I would say loss of vision is worse, you know, because if I could have seen,
Yes.
but I jump around more, could I move around more and work and do things.
Okay.
But because I'm a good chef, you know. A good chef, cook for 400 people more than cater for 400,
Okay.
500 people at times.
Oh, so you're able to cook now at home or you cook at home for yourself?
No, I just make a cup of tea, I have a coffee maker, just make some coffee and that's it.
Okay.
Or boil 2 eggs, that's it, nothing more.
Okay. Alright, so in terms of the furnitures, then, how you navigate to know where to walk? Because sometimes I see some persons blind and they walk so fast, or sometimes they even walk without cane in familiar areas. So,
Well, from me go inside my house, I put on the cane. And I can feel the staircase, bedroom upstairs
Yeah.
and the bathroom upstairs. I can find the bedroom downstairs, I come downstairs every morning and I'm alone live right now. So I can find the bathroom, go in the bathroom, bathe, and come down, brush my teeth, everything. And I find my house good. From I go inside my house, put on my key right there at the door. So I can move around good in my house. At first, it gave me a challenge, but now, I know my house like that.
Alright. And so any final word for the viewers in terms of loss of vision and how it's affecting you?
Yeah, just take care of your health. Take care of your health. That's the main thing, you know. Visit the doctor regularly, don't matter. We as man, we're afraid of the doctor. But what advice you just stop and just push your ego to the side and just visit the doctor and give the doctor a visit. It don't matter how often, but you give the doctor a visit. That's the main thing I leave you with viewers.
Alright, so well said, Mr. Hibbert. So just in summary, so we spoke about glaucoma today, and as Mr. Hibbert is saying, you should visit your doctor, and especially when you come on to vision, as soon as you start to have any issues at all, like blurred vision or pain in the eye, you should definitely seek medical attention.
True.
And as I said before, risk factor for glaucoma is like age, older you get, the higher the increased risk of getting glaucoma. So especially like for younger persons under 40 years old, you should actually aim to do a complete eye examination with an ophthalmologist every 5 to 10 years. And if you are beyond 40 years of age, you should try and do the examination more often, 5 years or less, or take advice from an ophthalmologist. So normally when you get a visit with an ophthalmologist, they will normally make a recommendation as into when should be your next visit and to advise you as in how to go about doing it. Alright? So remember viewers, thanks for tuning into another episode of In Office. Alright? And please remember to share, like, subscribe and leave a comment on this video. Until next time, stay tuned for more informative medical content and life, sickness and death.
Be sure to subscribe for more informative contents on life, sickness, and death.